Thank you very much, Dr. Elwood. We'll go to Simon Ateba from Today News Africa. Simon, please unmute yourself.
Thank you for taking my question. This is Simon Ateba with Today News Africa in Washington. The U.S. Secretary of State Antony Blinken lambasted the governments of Ethiopia and Eritrea at the weekend over what he described his own word as the continuing atrocity and denial of humanitarian access into the Tigray region in northern Ethiopia. The U.S. government is not ruling out sanction, but without access to the region, what is the coronavirus situation in Ethiopia in general and in the Tigray region in particular? Are vaccines being administered there? Does the WHO have access? Thank you.
Thank you very much, Simon. I'll give to Dr. Mike Ryan, please.
Yeah, I'll speak specifically to the situation in Tigray, and my colleague Ria may be able to just look up the numbers on specifically on Ethiopia today. You're correct, Simon. Access is the key issue in Tigray. Access to victims in Tigray remains highly unpredictable, and this is due to the hostilities and it's a huge barrier to access to the populations that need our help. The continued reports of atrocities and attack are disrupting any attempt. The majority of health facilities are either destroyed or inaccessible to the population. We're seeing rising risks of cholera, measles, and other outbreaks. We have also issues of continuing to get vaccines in. We have approved vaccine doses for northern Ethiopia for cholera vaccination, and we need to get those doses in there, and we need to plan those campaigns to avert a cholera disaster. It's still a huge number of people. There's 4.5 million people in Tigray. 3.8 million of them are in need of health assistance. That's the overwhelming majority of the people in an area. We have 2 million internally displaced people, 63,000 refugees across the border into Sudan. We thank our operational partners on the ground. We have many, and we're certainly trying to carry out operations in about 57 of the 93 were raided through our ad hoc mobile health and nutrition teams. But this is not enough. We need scale up and coordination and leadership, and we need access. And this is about access, and access, because unless we have access, safe access to populations who are protected and are not being attacked, we can deal with the current situation if we get that appropriate access and if hostilities can be reduced. But it is impossible to deliver sustainable humanitarian aid in the context of the ongoing conflict and the ongoing atrocities. And you've seen it all laid out in many different fora. Thank you. Maria.
Yeah, I could just briefly comment on the COVID situation, but just to say that we're limited by the surveillance that is able to be conducted in challenging situations. So as of the week of March 29th, there were around 14,000 cases being reported per week, and now we're seeing around 3.6 thousand cases reported to week, about 100 deaths per week. So this is something, our ability to detect trends, our ability to for countries to find cases and carry out public health actions associated with COVID is limited by the capacities to be able to do so. So we are supporting the country, as Mike has said, but through our regional office and country offices for COVID, as well as for other diseases that are circulating, other viruses that are circulating there as well.
Yeah, thank you. Yeah, thank you. I think parts of the issue are addressed. Thank you, Simon. That's a very important question. As we speak, the situation in Tigray, Ethiopia is, maybe if I use one word, horrific, very horrific. 4.5 to almost 5 million people need humanitarian aid. 91% need food aid. And many people have started dying actually because of hunger. and severe and acute malnutrition is becoming rampant. And as Mike said, hundreds of thousands of people have been displaced or expelled from their places. And more than 60,000 fled to Sudan. Rape is rampant. I don't think if that scale was seen anywhere else in the world, actually. Health services destroyed, looted, and majority of them are not functioning. And there is indiscriminate, unprovoked killing. And from this, what you would expect is majority of the people now residing in Tigray, Ethiopia, I don't think even they worry about COVID. So COVID is the list of their concerns, actually. It's not even their concern. And there is no service, of course, but it's not even a concern now. Because the chance of dying from all the issues, all the problems I have just outlined is really high. Compared to that, COVID is nothing. So I don't think for most of the part, we're not even in a position to discuss about COVID, to be honest, because there are more pressing issues. So the solution is de-escalating, stopping the conflict, and trying to address issues through political means. I think peaceful means. There is always a way. When there is a will, there is a way. The same is true in any area where there is conflict. If leaders could commit to resolving things peacefully, can be done. But the conflict and all the things that I have said actually affect the health of the population seriously. And that's the situation. And I don't think COVID is, to be honest, an issue. I would like to put it that way. Thank you.